Ovulation is the period for a woman when your ovaries release a mature egg. This usually typically happens in between your period cycle, that is around 14th to 18th day of your period if you have regular menstrual cycle. Now during this time, most of the women experience mild to moderate pain in the abdomen or lower backache. These pains or cramps are actually quite common. Now, what are the symptoms which are associated during this ovulation cramps? Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist, Laparoscopic Surgeon and Gynaecologist working at Vriksh Fertility, HSR Layout and Whitefield. What are ovulation cramps? Let's start with the basics. What is ovulation? Ovulation is the period for a woman when your ovaries release a mature egg. This usually typically happens in between your period cycle, that is around 14th to 18th day of your period if you have regular menstrual cycle. Now during this time, most of the women experience mild to moderate pain in the abdomen or lower backache. These pains or cramps are actually quite common. These ovulation cramps are also known as mittelschmerz. This is a German word which means middle pain. This is a natural part of your menstrual cycle and there is nothing to worry about if the pain is mild to moderate, and usually if it is for a small amount of time. But if it is persistent, severe, and if it is constantly associated with symptoms like severe vomiting, nausea, or causing disturbances in your day-to-day routine activities, or if it is not being relieved with any medication like painkillers, etc., then it is something to be worried about and it needs immediate medical attention. Now, what are the symptoms which are associated during this ovulation cramps is mild to moderate pain which is present for few minutes to few hours, which may be tolerable and sometimes may give you quick relief with a small paracetamol or any painkillers which your doctor advises. Sometimes this pain may be associated with little bit of nausea, vomitings, abdominal pain, backache, etc. Some women may also experience heaviness in your breast and may also experience heaviness or bloating in your abdomen. Sometimes some women may have uneasiness and may also complain of lightheadedness. Some women may also notice little bit of brownness discharge or white discharge, which is completely normal. Now this is a very common question which I get from most of my patients, that I can experience mild pain during or in between my periods. Does this mean that ovulation is happening now or is it going to happen? Research suggests that egg is released usually 12 to 24 hours from the time you experience this ovulation pain. So, if you're experiencing ovulation pain and you're planning to conceive, then try to be sexually active around this time in order to increase your chances of pregnancy. Now, what is the difference between ovulation pain and implantation pain? Now this is something which is very interesting because both the pains may appear to be similar. The symptoms associated may also feel similar, but they are completely different processes. Here's how you can tell them apart. Ovulation pain usually occurs in the middle of your cycle. It is associated with clear, stretchy cervical mucus and is mostly associated only with one side of the abdomen pain. While on the other hand, implantation pain happens usually 6 to 12 days after the ovulation pain, may or may not be associated with symptoms like cervical mucus changes, but are usually associated with early pregnancy symptoms and signs like mild cramping, pervaginal spotting, etc. And the lower abdominal pain is usually more of diffuse pain. How do we manage this ovulation pain? Firstly, you can use certain heating pads which are commonly available on your abdomen or on your lower back. Second, over-the-counter medications are available, like plain paracetamol may sometimes help, but it is always better to take medications after consulting your doctor. 3. Stay hydrated. If you're dehydrated, a small amount of pain may tend to look severe. Number 4. Meet your doctor. If in case the pain is severe or it comes quite often and is associating and is causing disturbance for your day-to-day activities, you could be having other medical conditions like an ovarian cyst or an underlying cause like endometriosis.